stereopsis. So this is the first case of anisometropic amblyopia. A 11-year-old male who had decrease in vision in his left eye, poor vision in his left eye. Even on TNO stereopsis chart also he could not read the first plate. The cycloplegic refraction was minus 0.75 at 180 and left eye was minus 2.75 sphere with minus 3 at 180. After giving 25 sessions of orthoptek, his vision was 6.6 in both the eyes and TNO stereopsis also improved and he could read all the three charts and the patient is orthophoric. Next, coming to the meridional amblyopia, this girl, 7-year-old girl, her performance in the school improved drastically, not only because of her patching and orthoptek exercises, but her daily activities, her crankiness, her handwriting, it improved drastically. Her refraction was minus 3.5 at 180 and minus 4.25 at 180. And her TNO stereopsis was also poor, but after 15 orthoptek sessions, her TNO stereopsis improved and her report card showed there was development in handwriting and her excellent behavior. So her mother was very impressed, and the reason behind is because the hand area is close to the frontal area in the brain, and hence stimulation of the eye area also stimulates the hand area, and we are coordinating it with the hand, that is we are doing the stimulus or active participation, that is pressing the button, superimposing the light, stimulation. It helps in the hand-eye coordination and improvement of handwriting. Third case was ametropic amblyopia, where an 8-year-old child had significant poor vision, right eye 6/9 and left eye 3/60. And TNO stereopsis was also 400 arc, left eye suppression. Cycloplegic refraction was +5 with +1 at 80 and +5 at +0.5 at 90 in the left eye with 624 vision. With 30 sessions, his vision improved and he was much better. Then there is a case of traumatic optic neuropathy, where a 20-year-old boy who had met with a road traffic accident, his vision was 3/60. After giving 25 orthoptic sessions of 30 minutes each, his vision improved to 636. He could see the form of the letter. He could, there was no searching movements or there was no gazing at different sites, but he could, there was parallel eye or there was a orthophoric on examination. So the person was feeling much better than before. But other cases of traumatic optic neuropathy or optic atrophy did not show much improvement. In intermittent exotropia, he was a 30-year-old male. He was dentist by occupation, having minus 0.75 at 15 degrees and minus 3.5 at 160 degrees cycloplegic refraction. The patient had almost 35 prism XT for distance and 12 prism XT for near. He also had ocular migraine and used to have lot of eye fatigue and eye strain after driving for long distance and long hours. He could not work. There was no depth perception. TNO stereopsis also showed poor stereopsis, but after giving good number of sessions, 20 orthoptek sessions, the exotropia decreased to 12 prisms for distance and 6 prisms for near, and his depth perception improved. He, being a dentist, had to do root canal treatment, so the depth focus also improved and he could do the root canal treatment in his patients in a better way. Strabismic amblyopia for 25-year-old male operated for 65 prism XT, had residual exotropia of 10 prisms. We suggested 20 orthoptek sessions and the residual XT got corrected. He was a tailor by occupation and hence his near vision was very important and convergence, but his orthoptek sessions improved both his convergence, his residual XT and his working. Another patient of 16-year-old with 20 prisms XT with intermittent exotropia had vision 612, 69. She was not operated, but after giving orthoptek sessions, she was orthophoric and her vision also improved to 69. This is another case of 6-year-old male child brought by mother who had vision of 618 in both glasses with minus 2.75 and minus 3 cylinder at 180. On examination, the patient revealed macular dystrophy. The patient had bullseye maculopathy. It was macular dystrophy, and the patient could not see objects which were fallen down on the ground. He could not pick up the objects or toys. He could not see at a far distance. But after giving orthoptek sessions, he could pick up this spatial recognition part improved. He could identify his friends passing by the window, and his mother was very happy for this drastic vision improvement, which was very surprising. And he also had a head tilt, and that also improved after the orthoptek sessions. His up-rolling of his eyeballs had also improved, and it was orthophoric, and his head tilt also improved. This was macular dystrophy, the fundus picture, and the OCT also showed ISOS thinning. But that also, in spite of that OCT picture, but still we gave them treatment and he has improved. So orthoptek or magnocellular stimulation is a treatment for amblyopia. It is much better because it is actively involving the performance of the child or the patient. It is not boring for the patient. There is active participation. He has to press the button and focus or superimpose the lights. There is success rate more than 95% at a very short duration of 3 to 6 months. And after the success duration, their vision has improved, but that vision also maintains at even after 1 year or 1.5 years. And stereopsis improves drastically. Thank you.
Thank you very much, Reshma. Now, those of you who are still skeptical, I am not surprised, because all these people who presented were skeptical and they showed their results with what it